Have you ever received lab results and immediately focused on the numbers highlighted in red? If so, you're not alone. I'm Dr. Joyce Golson-Dio. Many people assume that if a lab value falls outside the reference range, something must be seriously wrong. But the truth is, laboratory results are much more complicated than that. Today, I want to help clear the air about lab tests, reference ranges, and why one abnormal number is rarely the whole story. First, it's possible to understand that lab results can vary for many reasons. Different laboratories may use different machines or testing methods. The time of day your sample is collected can affect certain values. Whether you've eaten recently, exercised, taken medications, or even how much water you've had to drink can all influence your results. That's why healthcare providers don't look at a lab result in isolation. They look at the bigger picture. Let's talk about reference ranges. A reference range is created by testing large groups of healthy people and determining where most results fall. But here's something many people don't realize. The reference range does not mean that every healthy person will fall inside those numbers. In fact, some completely healthy people naturally have values that fall slightly above or below the reference range. Reference ranges are guidelines. They are not absolute definitions of health or disease. Here's another important point. Normal does not always mean healthy, and abnormal does not always mean disease. This is why healthcare providers look at your symptoms, medical history, physical exam findings, medications, and other laboratory values before making any conclusions. For example, a slightly elevated white blood cell count may simply mean your body is responding to stress or exercise. A mildly elevated blood sugar level could be related to eating before the test, stress, or illness. A slightly elevated creatinine level may be seen in people with more muscle mass or those who are dehydrated. So how can you help ensure the most accurate lab results possible? First, follow your healthcare provider's instructions carefully. Fasting means no coffee, juice, or supplements, only water, for 8 to 12 hours before the test. Water, however, is usually encouraged. Hydration is extremely important. And don't underestimate the importance of a good night's sleep. Sleep can affect blood sugar, stress hormones, and other laboratory values. One of the most important concepts in healthcare is that trends often matter more than a single lab result. Healthcare providers often compare your current results to previous results. A creatinine level that has remained stable for years may be much less concerning than a value that suddenly increases over a short period of time. That's where tools like CraveTheApp can be helpful. CraveTheApp helps users organize, track, and better understand their health information over time. Instead of focusing on a single lab value, users can monitor trends, keep important health information in one place, and have more informed discussions with their healthcare providers. CraveTheApp is available now in both the Apple App Store and Google Play Store. Understanding the bigger picture is often more valuable than focusing on one number. The bottom line is this: laboratory tests are important tools, but they are only one piece of the puzzle. Results can be influenced by many factors, including laboratory methods, hydration, fasting status, medications, exercise, and timing. Always discuss your results with a qualified healthcare professional who can interpret them within the context of your overall health. This content is intended for educational and informational purposes only and should not be considered medical advice. Always consult a qualified physician regarding your health concerns. The opinions expressed are those of this author.